Your best source for local news. KIRO News Radio. KIRO FM, Tacoma, Seattle. Northwest News.
It is 8:15, KIRO News Radio. There's a need for blood across the region. Winter weather, the holidays, and more are leading to blood donation appointments being canceled. According to BloodWorks Northwest, patients have transfused more than 620 more units of blood than were donated. Joining us now is Vicky Finson, BloodWorks Northwest Executive Vice President for Blood Services. Vicky, good morning.
Good morning, Paul.
So listen, why is blood donating so important at this time of year?
Well, this time of year is always a challenge for blood centers because people are busy, right? Many people take a break, kids are out of school, people are traveling to see friends and family, or they have guests visiting them, or they're just out doing things. And so we always gear up coming into the holidays. And this year, oh my gosh, we got that amazing snowstorm, ice storm, et cetera, et cetera. So many donors could not reach us. Many mobiles were canceled because we couldn't get there. We had to curtail some collection sites too because our staff couldn't get there. And first and foremost, we always want to keep everyone safe. But now I just heard your great weather and traffic together guy, and it sounds like it's the perfect weather forecast to come donate blood. And he even said that you can travel pretty easily today on the roads. It sounds like traffic isn't bad. So I was just thinking, if someone's listening and hearing that, you can't say one of your excuses is that it's snowing or that the traffic's bad. So we would sure appreciate it if you would go to bloodworksnw.org, make an appointment for a convenient donor center or mobile near you. And, you know, the sooner the better. But if you're busy this week, gosh, what a great New Year's resolution, and come in next week.
Hey, Vicky, this is Lisa Brooks. We have done many times your needs, your emergency situations. Do you get any kind of a notification on a day-by-day basis of what kind of significant surgeries are happening today, what's happening next week? How do you anticipate and fill the needs that you have on a regular basis?
Wow, that's a great question, and it might take us a long time to really go into that. But at a high level, we do a lot of forecasting. We don't actually hear day to day what's going on because actually that's too late, right? We need to be weeks ahead, or at least days ahead of what the need is going to be. Red blood cells have a 42-day shelf life. Platelets only have a 5 to 7 day shelf life, and platelets have been in very, very high use lately. But we trend, and we're pretty close to it. And right now, we have a few of our large, complex medical centers using record amounts of blood, and I believe that a lot of that is still backlog from patients who weren't getting the care they needed earlier in COVID. So we're pretty good at anticipating what our needs are. Our problem right now is that we don't have enough donors to meet those needs.
We're speaking with Vicky Finson, BloodWorks Northwest Executive Vice President for Blood Services, and I can hear why you've ascended to that title. You know, the roads are clear, but sometimes people's schedules are not. Are there mobile units that folks can visit? And if so, are those locations on the website?
They are. Great question. Absolutely. There are mobiles on the website, and we are running more of those than we were earlier during the pandemic. Our staffing is great right now. We've got a lot of new folks coming in as well. So there are lots of great opportunities for people to donate. And I always like to say, you know, yes, we need you today, but if you can't come in today or you can't find something that's convenient for you, we draw blood 364 days of the year, and we transfuse 365. The one day we don't draw is Christmas, and because that's a day where a lot of donors can't come in, and we give our staff that holiday. But we were very busy on Christmas Day. I had a note from a colleague that she visited with her son-in-law and daughter in the hospital who was being transfused with 3 units of blood on Christmas Day to fight his leukemia. And she said it just brought it home to her, but that's what we do every single day of the year. And she was grateful to her colleagues for their work to keep the blood supply there and safe, but she was very grateful to the community as well, who had provided those life-saving blood units for her son-in-law.
Vicky, I'm curious to know who cannot donate blood? Are people on, for example, blood thinning medications or blood pressure medications, are they not considered good candidates to donate blood?
Well, it's pretty complex. And if you go to our website, there's some basics, and also you can email us or call the number there, and people will help you assess that. Most medications you're fine if you've been up and stable. There are exceptions, so I don't want to go into that. And, of course, there's other things that preclude you from donating. The FDA, the Food and Drug Administration, very rightly so, sets the criteria for who can donate, and it's for two reasons. One, to keep the donor safe, and two, to keep the patient safe. There are some criteria that have changed recently that allow more people to donate. And on January 18th, we have another big change happening that the FDA has just relaxed more regulations around mad cow disease to allow more people to donate blood. So it changes all the time. Our medical staff also keeps abreast of what we know now, right? Because medicine evolves, is ever evolving. So it's hard to answer that, but many people who think they aren't eligible actually are. So if you don't know, the best thing to do is come on in and we'll let you know, or give us a call and we'll help you assess that over the phone so that you don't come in and then unfortunately not be able to donate. There are some things day of donation. Like we make sure that your hemoglobin level's okay. We make sure your blood pressure, your pulse, your temperature. So those sorts of things have to be done day of donation. And again, those are highly regulated by the FDA to keep the donor safe and the patient safe and to keep our staff safe as well.
Vicky, I've been a donor since I was a teenager. In high school, I started. I'm an O-negative blood type, and I know that's the universal donor type. But I imagine all blood types are needed now.
They are, but when you said O-neg, I just smiled, Paul, I have to say. You're right. All blood types are needed now. And sometimes our A donors, I'm an A-pos, feel like, oh, you don't need me. No, we need everyone. And there's other kinds of donations, too. So we draw platelets, like I said, and A's and donors are great for platelet donors. But right now, we do need every blood type. You're right. O's are used for trauma. So they are always in very high demand because O-neg and some O-pos can go to all patients in emergency need. It seems like the trauma's been pretty quiet, knock on wood, right now, but we have to always be prepared because we, just don't know what might happen, and certainly we have some very, very large trauma centers here that we support.
We sure appreciate you getting the word out, and we're happy to help do that. How often can people donate blood?
You can donate what we think of the traditional blood donation of whole blood every 56 days. And actually platelets you can donate up to 24 times a year, and many of our donors donate every month or even twice a month. Again, regulated by the FDA. I just want to say you do need an appointment. We began appointment only early in the pandemic, and we are sticking with that for two reasons. One, we find that the donors like it better because the time is better. We accommodate you immediately, we get you in, and there's no waiting, and it's very predictable. I think many things during the pandemic, we've all gotten more accustomed to appointment only, and we see the benefits. The other thing is it helps us predict. We can look and see what our appointments are today, tomorrow, and that's why we're calling this code red. In the past, we were blind. So for those couple reasons, we're going to stay appointment only. And I also do want to mention that we are masking right now. We want to keep everyone safe, not just with COVID, but RSV, the flu, and all of that. And I know some of the public health officials have come out lately and urged folks to mask inside. So we are masking, and we'll continue through this cold flu season, and then we'll reassess that in the early spring.
Smart idea. Vicky, thanks so much. Vicky Finson, BloodWorks Northwest Executive Vice President for Blood Services. Good luck today and every day in the good work that you do.
Thank you, and thank you to the community of donors who do regularly donate. We really, really thank you. You save people's lives every day.
Well, it's our honor to be a part of it.